Hi everybody, Dr. Payne here, and today I want to talk about abdominoplasty, or tummy tuck as it's commonly known. This is a very popular procedure and it's sought by people that primarily have loose skin of the lower abdomen. Who's a good candidate for an abdominoplasty? Well, the main criteria is that the problem is usually loose skin, more so than intra-abdominal fat or fat inside where the organs are. And for female patients, patients who have completed their childbearing. Interestingly, you can get good results from a tummy tuck in patients not meeting those criteria, but it depends a little bit on what's going on, how good the results you can expect. So I always try to outline what I think is possible there. Backing up a little bit, the primary consideration is actually safety. Tummy tuck, if you go back and look at it historically, back to the 1990s, there were surgeons that were getting a lot of problems with this procedure, and it was the bad boy operation of that era, especially if combined with breast procedures, things like that. I think we know a little better how to handle patients these days, and certainly the approach I bring to surgery, I have not had that kind of problem in my practice. So we want patients that are medically optimized. Sometimes people will seek me out because they had been turned down when getting consultations elsewhere because of their medical problems. That's fine. I actually welcome those patients because I'm willing to put in a little extra effort to see what their background is, what kind of medical problems do they have, do I need to coordinate something with their primary care or their specialist to make sure things are under control and optimized. I'm willing to do all of that. And it is very rare that someone has a medical condition that's so significant that they actually can't have surgery at all. Those are possible, but they're not very common. Sometimes the surgery might need to be done in a hospital setting, and I can do that too. But we try to avoid that for a lower cost consideration when possible. But for some patients, the other options are necessary. Abdominoplasty ranges from the lowest end, which is like a mini abdominoplasty, where we're just removing loose skin from the lower abdomen without cutting around the belly button, or sometimes the belly button's actually cut but not on the outside and it's brought down a little bit. That's kind of an interesting technique. Not commonly used, but it is done when needed. The standard type of abdominoplasty does involve an incision around the belly button and then in the lower half of the abdomen, in the groin area there. And the excess skin is taken out. I tighten the muscles in virtually 100% of cases. Sometimes people will say, well, they wouldn't tighten my muscles because they figured it would be too much risk. That is sometimes possible, but in almost all cases, I can tighten somebody's abdominal muscles. I also don't remove the belly button. I've seen people that have come in after having a large pannus and they were told that the tummy tuck needed the belly button to be removed. I get why they think that, but I haven't found the need to do that. I've reconstructed belly buttons for people in those situations. So they come in with a tummy tuck, decent looking overall, but there's no belly button there. We can't have that, so we'll fix it for them. All the way up to the inverted T procedure. And that was more commonly done when people had up and down incisions with the bariatric surgery. These days, our general surgery colleagues tend to use laparoscopic incisions, which are small, so people don't tend to come in with a pre-existing vertical scar. If they do, even if they're getting a standard abdominoplasty, you might as well take advantage of that scar. You can actually get things pulled in more with the inverted T procedure. But I won't put that inverted T scar on someone unless they want it. Rarely people will request it. Or they really do have, we'll talk about it, if they have so much central skin that the standard type of abdominoplasty won't work for them. So we'll have that talk and go over that. And that's more commonly seen in people that have really tremendous weight loss. Not your typical, I lost 20 pounds or I had 2 children. It's really somebody that said, look, I was really heavy and I either used now the weight loss medications or diet and exercise or bariatric surgery and I've lost over 100 pounds. Those are the people that are more likely to get into that inverted T territory. Abdominoplasty can be combined with other procedures. I will take a look at the overall situation to make sure we can do it safely, but I do very commonly mommy makeovers where some kind of breast operation is being done along with a tummy tuck. You can also add abdominal etching in cases where someone's thin and they want to get more definition of the abdominal musculature or the central groove there. That is possible to be done. I will also fix hernias if they're there. Also a general surgeon, in addition to being a plastic surgeon, I can handle standard types of hernias without any real difficulty. If people have previous surgical adventures on the abdomen, I've seen people with all sorts of roadmap of scars, and we've gotten good results. Sometimes those scars are removed depending on where they're located. And that's the basic overview of abdominoplasty. It is a fascinating area. It's a very common area, and there's a lot of things that are possible, and we can get very good results in just about anyone. So if you have a abdominoplasty question, give us a call. We can go over things, take a look, and we look forward to helping you out. So take care.